episode. Today we're talking about cosmetic surgery and tummy tucks with Dr. George John Bitar, American board-certified plastic and reconstructive surgeon. So, Dr. Bitar, tell me a little bit about the typical patient who comes to you for a tummy tuck.
Well, Kevin, there are, in this day and age, there's almost no such thing as typical. Everybody comes from a different background. There is that woman who's had children, who has loose abdominal muscles, excess skin, and excess fat, who would be a good candidate for a tummy tuck. There's also that man, for example, who's had a gastric bypass surgery, who's 55, 60, who has now loose skin and loose muscle and excess fat, who would also be a good candidate for a tummy tuck.
So it varies across... when you say that?
No, I was so it really varies based on a person's anatomy and their at the point in which they are in life and their desires.
Is this an outpatient procedure for most people?
For most people, I would say it is an outpatient procedure. There is a small percentage of people that may have a little bit of a medical history that may necessitate for them to stay in the hospital overnight. But quite frankly, I tell my patients that if you have a medical risk that would make it a higher risk operation than needs to be, then I tell them that a tummy tuck is not for you.
And how long a procedure is it, and does it require general anesthesia?
Some people do it under local anesthesia with sedation. I prefer to do it under general anesthesia for a patient's comfort and for the safety of the operation.
You know, so if I came to you and I said, okay, let's do this, Dr. Bitar, what would I expect? What would you do, and what would be the procedure?
Sure. First, it's very important for a patient to understand what they are going to undergo, because this is cosmetic surgery, as you know. It's not necessary surgery per se, like a heart transplantation or a kidney stone removal. This is something that people do to feel better about themselves. And so therefore, I want to make sure, number one, they are healthy. And I always ask the patients to go to their own private medical doctor to clear them for surgery by getting the necessary lab tests and the necessary medical studies. And then we look at their body and see if they are a good candidate from an anatomy standpoint. In other words, if they have excess fat and if they have loose abdominal muscles, that would make them a good candidate for a tummy tuck. Then I explain the surgery for them. I discuss with them the risks and the benefits of the surgery, give them names of patients who've had the same surgery, let them talk to them on the phone, get a very realistic explanation of what the people who did it went through, because I believe that an informed consent is not a paper that you sign, but rather a process that you go through. And then when a patient is ready, they come back to me. We meet for a second time. If they want to bring their spouse, a significant other, or they want to come by themselves, we kind of go over the points again. My nurse will be available to answer questions, and then we go and proceed with the operation.
What are the risks that you tell people about?
A tummy tuck is a major operation. It is not to be undergone lightly. There are risks, and the risks sometimes depend on the person who is undergoing it, as well as just the nature of the operation. With any operation, anytime you cut the skin, there's a risk of bleeding, there's a risk of infection, there's a risk of having a scar. It can be hidden with clothes, but nevertheless the patient needs to know that they're going to have that. There is also the anesthesia risk, which in today's world is a very low risk, but it still exists.
You know, I hear about liposuction as well, and I guess sometimes it may be confusing for some people. What's the difference between liposuction to get rid of some of that fat and a tummy tuck?
I'm glad you asked that question, Kevin, because sometimes patients come to me, say they want liposuction when they need a tummy tuck, and vice versa. Liposuction removes unwanted fat from the abdominal area, and an ideal person who gets a liposuction of the abdomen is someone who has nice tight skin and nice tight muscle, and the only thing they have in excess of is fat. On the other hand, a patient who is a good candidate for a tummy tuck procedure or an abdominoplasty is someone who has excess skin, loose muscles, such as a woman who's had children or a man who's lost excessive weight, and plus or minus excessive fat. In other words, for someone who has loose skin and loose muscles, the liposuction is not going to be the ideal situation, versus for a girl who is 22, 23 years old, who has a little bit of excess fat a tummy tuck is a bigger operation than she needs.
So it sounds like for our older viewers, where we do have a lot of loose skin and loose muscles, that maybe the tummy tuck is a better procedure in most cases.
For the most part, you're correct.
Okay. Does one work better than the other most of the time for you in terms of surgery itself, or does it make any difference?
I mean, liposuction is a lesser invasive procedure. It's a quicker operation which has less chance of risk. But on the other hand, you have to match the operation to the patient and make sure that you give them an operation they're happy with. Because if you do a lesser operation and the patient is not happy, because you did not do enough, you would not have accomplished the goal of the patient.
You know, some people say, well, you know, if you want to lose that abdominal fat, just, you know, cut down on your food and exercise more, and you're going to get rid of all this fat. But that's not really true, is it?
There is some truth to it. I always tell my patients that any cosmetic operation is a last resort. It's not a first resort. In other words, I never tell them that a tummy tuck or a liposuction, for that matter, is a substitute for good health practices and a good diet. We have a dietitian and a physical therapist on one of our associate staff that we refer patients to if I feel they need to lose weight and tone up their muscles before I do any operation, not just a tummy tuck.
When we come back, we'll tell you more about what you need to know about choosing the right plastic surgeon. Healthline will be right back.